These face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control.
The head of the CDC there on Capitol Hill today reinforcing what every other doctor and scientist keeps saying, mask wearing essential to contain this virus. But inexplicably, the president continues to push back. Take a listen to what he said during an ABC town hall last night.
There are a lot of people think the masks are not good. And there are a lot of people that, as an example,
Who are those people?
They come over and they serve you and they have a mask. And I saw it the other day where they were serving me. And they're playing with a mask. They're playing with a mask. So the mask is over and they're touching it and then they're touching the plate. That can't be good.
Waiters. The president also said again that the virus would just simply disappear. It's not happening, not even close. The U.S. has more than 196,000 fatalities and counting, with more than 1,200 deaths in just the past 24 hours. Plus, we're still averaging about 40,000 new cases every day, and the total now above 6.6 million. Also, even though the president is saying that we could have a vaccine within weeks, not months, the Center for Disease Control just announcing that the general public likely won't have access to one until the middle of next year. CDC saying when one's developed, supply will be limited. First responders and those at greatest risk will be the first to get it. Now, while we've been focusing understandably on the lives lost to the virus, going forward, we're also going to be speaking with people who have survived COVID but are still dealing with complications like scarring of the lungs, joint pain, headaches, shortness of breath, and so much more. If you've had COVID and would like to talk to us about it and your experiences, we want to hear from you and even have you as a guest on our program to tell your story. Please email us at rfl@rnntv.com or send us a tweet at our handle LarryEP13. Now, though, I want to bring in our guest, Diana Berrent. She's a COVID survivor who got the virus back in March, but still dealing with major complications like major eyesight problems, intestinal issues, and pounding headaches. Diana is also the founder of the COVID Survivor Corps. It's an online group connecting and educating people about the virus, and it's got more than 100,000 members. Diana, you know, for a lot of us, we look at a TV screen and we'll see a couple numbers, the positive, how many people, you know, how many cases we've had in this country, and unfortunately how many fatalities. But there's a third number, and that is how many people not only contracted the virus but still suffer from it. You're one of those people, but there's many others like you. Give an idea of what you've gone through since March when you got the virus and how it's still impacting you today.
So I'd love to talk to you about that. But the one thing that I do want to point out is I am 6 months from having COVID and I am still having GI issues. I am having really terrible headaches, inner ear pain. I was just diagnosed with glaucoma, sort of out of the blue, which was the doctor thinks was onset by COVID. But all in all, I am extremely lucky compared with most people who are suffering from long COVID. And the frightening thing is what we are learning is that 1/3 of people who are infected with COVID are not recovering in the expected period of time. And of that, 1 in 5 young, healthy people with no pre-existing conditions are not recovering. And when I say not recover, I'm not talking about a mild headache or, you know, just some bothersome issues. I'm talking about things as severe as COVID onset diabetes, COVID onset lupus, severe neurological issues, severe cardiac issues. Now that we know that it is a vascular disease rather than a respiratory disease, we are starting to have a little bit more understanding of why it is impacting every organ system.
I've heard people say, I'm afraid not just now what I'm going through, and they talk about these debilitating headaches that literally, you know, they can't get through, but the scarring to, you know, all the critical organs, whether it be the heart or the lungs, they're worried. And in many ways, it brought me back to the stories I've talked to people since 9/11, those people who suffered so many of the issues and weren't of the fallen, but we've lost so many people since 9/11, as we know, because of the toxins that, you know, forever changed their breathing and ended too many lives prematurely. Is that the fear? You started this group. There's more than 100,000 people, so you're hearing stories from so many people about what they're dealing with, not just now, but what they're afraid their future looks like.
Oh, absolutely. And when you do the numbers, it's absolutely staggering. I mean, we are upwards of 6 million infections in the United States right now. And I think it's safe to say that the CDC's numbers are conservative at best. But let's take them at their word. At 1/3 of people with over 6 million infections, you don't need to be an epidemiologist to do the math to see how many people are suffering. And of those people, it's important to note how many of them are young, previously healthy people with no pre-existing conditions. There are so many members of Survivor Corps who are in their 20s and their 30s. People, one member who is a fitness instructor in Los Angeles, 28 years old, she just posted yesterday. She's 6 months from having COVID, and she was hospitalized yesterday for suspicions of a heart attack. We're seeing people in their 20s having mini strokes. We're seeing lasting cardiac damage on autopsies from people who are asymptomatic. So when you bring up that 9/11 parallel, I think that is really something to think about. It's a little far in our history to go back to the aftermath of polio. But apparently there are some similarities there as well. And so when we're talking about young people who are on either, they're on day 150 of having a fever, who have neurological issues that are so severe that they cannot return to work, we are going to have to reimagine healthcare. We are going to have to reimagine disability insurance. There are going to have to be many, many changes because we are looking at what will likely be the largest group of disabled people in America, ever, including in any wartime.
I try to imagine what you're going through, and beyond obviously all the health concerns, short and long term. I would imagine there's a couple things that would drive me crazy if I was in your shoes and many others like yours. One, the stories that when you finally do get to see a doctor, they'll chalk it up to anxiety, what you're going through. And the other thing is when your president basically says, hey, you know what, there's really nothing to worry about here. It's basically a glorified flu, discounting the nearly 200,000 dead Americans. For people like you, when you hear that, I can only imagine what goes through your mind.
Look, nobody should be underestimating what is going on to the people who have been infected. And our priority needs to be the depoliticization of science. We need to keep science as sacrosanct as we keep our military. And if we politicize either, it dismantles our faith in both institutions. And so we are working at Survivor Corps to work hand in hand and create an educational feedback loop between the patients and the medical community. So we are partnered with universities, we are partnered with biotech companies, we are partnered with blood banks, we are partnered with just about every segment of this COVID world. And we're really trying to look at it as a forward-looking solution-based mission. Healthcare access is truly at the core of it. And we're looking at a lot of communities that were medically underserved to begin with. I was very lucky to get into Mount Sinai's post-COVID care center, but the waiting list is through next summer. We need to have centers like that throughout the United States, just like we have urgent care centers.
We've learned different terms throughout COVID, and another one is long haulers, and it describes people just like Diana, and there's far too many of them that are going through this. So we've brought up the Survivor Corp URL, and I suggest anyone that can relate to the stories Diana's telling to go there yourselves, share your story as well. And there are people looking to help you get the help you need here. But Diana, I appreciate a few minutes with you, and I wish you honestly the best of luck. Thank you for the time.
Thank you very much. And may I also ask everybody who goes to our website, please, if you have the antibodies, sign up to donate plasma, sign up for every scientific, medical, and academic trial and study for which you qualify. So many of the answers to this virus lie in our bodies, and we need to help the scientists get to the bottom of this. We will be part of the solution.
Diana Berrent, thank you again. I appreciate it.
Thank you.
We'll be right back with more.